Anatomy, physiology. During the first 2 months of embryonic development, there is no much differences between male and female sexual structures. Embryonic phallus become a penis in a male and clitoris in female. Penis consists of 3 parallel cylinders of spongy tissue, 2 are corpora cavernosa, and 1 lower side passes urethra is corpus spongiosum. During the erection, the blood rushes to these chambers and penile shaft become hard. Similarly, at the penile shaft lateral side there is a testis which secretes hormone testosterone along with this semen sperms. These sperms pass through epididymal tubes around 20 feet long and that open in urethral meatus. And in the same tubes, same urinary tract, take the semen and it used or passed during orgasm stage in puberty. In the female, similarly, there is a vaginal passage around 3 to 4 inches and at the end is the minor and major muscles which construct the vaginal tract. It's called minora and majora. Female secrete the ovum. During the birth, there are around 2 million of ovum follicles. Then it reduces to 2 lakhs follicles in adulthood and reduced to 350, and out of that 1 follicles ovum is fertilized and implanted in the muscles myocardium of uterus. Dear friend, this is the common anatomy of male and female. In female, ovaries are inside abdomen. In male, this is outside in the scrotum in the form of testes. In male, if we look toward the penile shaft, the front portion is called the glans penis, which is covered by the skin. That skin is called the prepuce, and there is a secretion of sperma. That sperma you have to clean every day during your bath. You should not apply any cosmetics there. That is a more allergic and may become hard and painful during intercourse. Most of the patients having complaint of phimosis because of this. My dear friends, there are other disorders like fungal infection, other things. Other part you can apply any soap and whatever you want, particularly shampoo and body lotions, etc. Once you know anatomy and physiology, particularly in physiological role, particularly in the brain, there is a sex center inside the limbic system. Near to the hypothalamus, there is a pituitary gland which secretes follicle stimulating hormone and luteinizing hormone, two hormones, and that control your spermatogenesis in the male and in female, particularly ovulation. Female hormone is called estrogen, male hormone is called the testosterone. The whenever sex drive desire is based on these hormones that control your sex drive. The testosterone is very important factor in male to keeping their sex drive constant, and erection helps during orgasm stage. Dear friends, in this process, particularly when the baby grown up to particularly from 0 to 1, as per the psychoanalyst Sigmund Freud said, oral stage, psychological development, oral stage, anal stage, phallic stage, and genital stage. These are the stages, particularly starting from 0 age to 9-year age. This all development starts. If anything is not developed or not psychological handled properly, oral stage like 0 to 1 year, particularly here with the baby, most in the milk feeding stage, and after that we will take in details in next videos.